Welcome to today's class. In this video, we will talk about the pharmacology of sex hormone. Now, there are three main sex hormones: estrogen, progesterone, and testosterone. Now, for this video, we will focus on estrogen. Before we proceed, I would love to ask you a question, and I want you to ponder on this. What do you think are the main use of estrogen? What do you think are the main use of estrogen? Alright, there are two main use of estrogen. Two main use. Number one as contraceptives, and number two as hormone replacement therapy. Now, women that are of reproductive age that are sexually active use estrogen as contraceptives. They usually combine it with progesterone. Also, women that have approached menopause use estrogen as hormone replacement therapy because during menopause the level of estrogen is drastically reduced. So we replace estrogen in such women because they tend to have what we call post-menopausal symptoms like hot flushes, and their bone tends to be brittle. So we have hot flushes and increase in bone resorption. Increase in bone resorption. So they usually have brittle bones. These are postmenopausal symptoms. Now, let's proceed. Now that we've known the main use of estrogen, either as contraceptives or as hormone replacement therapy, let's now proceed to talk about where is this estrogen synthesized. Now, estrogen is synthesized mainly from the ovary, and in pregnant female, the placenta also produces estrogen. But to a minor amount, estrogen is also produced from the testes and the adrenal gland. Now, it is important to note that the precursor for the synthesis of estrogen is cholesterol because estrogen is a steroid hormone. So, I know all steroid hormones are synthesized from the primary molecule cholesterol. So, cholesterol is the precursor for the synthesis of what? Estrogen. And it will interest you to know again that the immediate precursor, because before cholesterol will form estrogen, it will first give rise to androgens. So it is from the androgens estrogen will be synthesized. Okay, so but at the end of the day, the starting molecule for the synthesis of estrogen remains cholesterol. Now, it is important for you to note that there are three main types of natural estrogen, that is the one that is synthesized in the body. We have estrone, estradiol, and estriol. Now you can see one here, so that gives it away as E1. You can see estradiol, that here, that gives it as E2. You can see tri here, that gives it as what? E3. So estrone, estradiol, and estriol, they are all examples of natural estrogen. They are naturally produced in the body. Of these three, the most abundant is estradiol. That is the most abundant. Now, estriol, you usually see estriol in pregnancy. Okay? Now, how does estrogen works? Estrogen is a steroid hormone, and you know steroid hormone, they work by acting on intracellular receptors and receptors located on the nucleus. So they cause the transcription of genes. So the receptor for estrogen are ERO alpha and ERO beta. There are two main receptors, ERO alpha and ERO beta. That is estrogen receptor alpha and estrogen receptor beta. Both of them are located intracellularly. However, it is important for you to note that there are certain actions of estrogen that are called the actions of estrogen on the blood vessels. Such actions are rapid and it requires a membrane receptor. So this is a side knowledge that certain estrogen receptors are located on the membrane of cells, not necessarily on the inside of the cell, but on the membrane of the cell. And for those receptors, the action of estrogen is rapid and they are usually vascular action, vascular response. For example, they want to produce nitric oxide for vasodilation. You can get such rapid reaction from such receptor. And those membrane receptors are G protein coupled receptors. But the main, when you are asked where is estrogen receptor located, your answer should be intracellularly and in the nucleus. They are not on the membrane. However, there are a few exceptions to that, which is the vascular response or the vascular action of estrogen require the receptor to be on the membrane. Now, natural estrogen, as we've seen, there are three of them: E1, E2, and E3. None of these can be given orally. We can't give them orally. Reason because they have a poor first pass metabolism. So their first pass metabolism is high. They have a high first pass metabolism, and for that we can say that they cannot be given orally because they will be destroyed by the liver. Okay, they will be destroyed by the liver, hence they are not given orally. Rather, we prefer to give them as transdermal patches. We give them as what? Transdermal patches. Okay, now to overcome this challenge, we start synthesizing estrogen. We look for ways to synthesize estrogen. So we have certain synthetic estrogen. We have synthetic estrogen, which we can now give orally. But for the natural estrogen, due to their high first pass metabolism, meaning they have a low bioavailability, you get, so we only give them transdermally. We can't give them orally because if you give them orally, the amount that will be reaching systemic circulation will be reduced. However, to overcome this challenge, we set out to make certain preparations of estrogen that are synthetic. Okay, and there are two main types of synthetic estrogen. It could either be steroidal or non-steroidal. So if it is steroidal, it means it has a steroid nucleus. If it is non-steroidal, it means it does not have a steroid nucleus. Now, there are three main types of the steroidal estrogen. We have ethinyl estradiol, mestranol, and tibolone. Ethinyl estradiol, mestranol, and tibolone. Now you can see estra. You can see estra. Okay, the only exception to this is this tibolone. Okay, so again, ethinyl estradiol, mestranol, and tibolone. All right. Also, we have the non-steroidal synthetic estrogen. This popular one is called diethyl stibesterol. Diethyl stibesterol, and we have dinesterol. Okay, dinesterol. You can see the esterol. Okay, so these are the synthetic form of estrogen. We set out to develop this one because there was a limitation of the natural estrogen. The natural estrogen was limited to be given as what? Transdermal patch because of high first pass metabolism. The synthetic estrogen, we develop them so that we can be giving them orally amongst other routes. You get, so that by this one now we can increase their bioavailability. Okay, but again, always remember that the main use of this estrogen, whether natural or synthetic, is for contraceptives and hormone replacement therapy. Although there are still some other use, hormone replacement therapy will cover for them majorly. So let's just proceed. That's what I said here. I said again, remember, it is as contraceptives and in hormone replacement therapy. Now, hormone replacement therapy does not necessarily mean it is limited to just menopausal women. No, it could also be for somebody having primary hypogonadism. So a patient experiencing primary hypogonadism, we can replace estrogen so that their secondary sexual characteristics can be developed. You get? Also, if estrogen is given in a cyclical manner, it can be used to induce ovulation. If estrogen is given in what? In a cyclic manner, it can be used to induce ovulation. But you cannot remember that. Please remember that the main use of these estrogens are as contraceptives and in hormone replacement therapy. Okay? Now let's look at the individual one. Here we have 89 estradiol. Again, its main use, it can be used for both of them as hormone replacement therapy and as contraceptives. Same thing with mestranol, it can be used as hormone replacement therapy and as contraceptives. But tibolone is an exception. Tibolone can only be used as hormone replacement therapy. We don't use tibolone for contraceptives. The reason for that is because tibolone is non-specific. It can act on all sex hormone receptors. Tibolone can act on progesterone receptors. It can act on testosterone receptors. And if tibolone acts on progesterone receptors, what does that mean? It means that it could cause shedding of the endometrium. It could cause what? Shedding of the endometrium. And if it acts on testosterone receptors, you can see side effects like ink, hirsutism. Hope I'm spelling it well. Hirsutism is where you begin to see facial hair growth. Okay, so you can have these ones, ink and hirsutism, as a side effect of use of what? Tibolone. That's why we just limit tibolone to women that are already older, that are already in their menopause. So we don't use tibolone as contraceptives. Now, for the non-steroidal estrogen preparation, we have diethylstilbestrol and dinesterol. Now, diethylstilbestrol is no longer used. It's no longer used in females because it has a side effect. It has a major side effect. There's a major drawback to diethylstilbestrol. Certain pregnant women were taking diethylstilbestrol as contraceptives in order to induce abortion. You get, but again, it was discovered that it has link with certain cancers, particularly vaginal adenocarcinoma. So that's why it was banned. However, it is still being used today in males. It is still used today in males as a what? As in prostate cancer. Males with the prostate cancer. You know, prostate cancer is testosterone dependent, and when you give this diethylstilbestrol, what it does is that it tends to reduce the levels of LH and FSH. It reduces the levels of LH and FSH because it acts as a negative feedback. It acts as estrogen, so it will signal the pituitary that there is enough estrogen, so no need for FSH and LH. So if there's a reduction in FSH and LH, also there will be a reduction in testosterone level because FSH and LH are still responsible for the production of testosterone in the gonad. So that's how it works. Okay, so now we only use it as what? In prostate cancer, while dinesterol can be used in senile vaginitis. Okay, that's where we use dinesterol now. Senile vaginitis. Alright, so I believe in this video I've been able to communicate to you that the main use of estrogen is in hormone replacement therapy and as contraceptives. Okay, and we've been able to see that there are three main natural estrogen, and their limitations again was that they cannot be given orally, so we opt for the synthetic estrogen, which include your which should either be steroidal or non-steroidal. All right, then we're able to say, okay, one final thing I will say now is that all estrogen, all forms of estrogen, all forms of estrogen are contraindicated in pregnancy. You don't give them in pregnancy, okay? I believe you can remember diethylstilbestrol, ethyl This was a disaster. It causes what? Adenocarcinoma of the vagina. Alright, so that is all for this video. In the next video, we progress to talk about the SEMS. Alright.